Back pain is no joke. Nearly 65 million Americans suffer with it each day, according to the Health Policy Institute. Joining us this morning with the latest on different treatment options is Senior Associate Director of Global Medical Affairs at Bayer, Dr. Natalia Serrano. Good morning, Dr. Serrano.
Good morning. Thank you for having me.
Yes, it's wonderful to be speaking with you on this. Now, what did this new study show about back pain relief?
Yes, so as a Bayer Medical Affairs employee, this study I found particularly interesting. It examined over 300 trials of non-surgical, non-interventional treatment options for the management of low back pain. And it found that amongst the few that were found to be successful were NSAIDs for the relief of acute low back pain. NSAIDs stand for nonsteroidal anti-inflammatory drugs, and they're the types of active ingredients found in products such as Bayer aspirin and Bayer Relief. This study reaffirms the role of NSAIDs as a science-backed option, underscoring their value as part of non-opioid first-line care treatment for low back pain. And it's reassuring to see these efficacious options like NSAIDs that are validated by these rigorous, robust, placebo-controlled scientific studies.
Doctor, how would you explain, because you mentioned acute pain, how would you explain what that is?
Yes. Acute pain is short term, it appears suddenly, it does not last for more than 6 months, and it is usually the result of injury, surgery, or illness. And it's essentially your body's way of raising its hand and saying, hey, there's something wrong here.
Now, beyond medication, what else should we be doing to alleviate back pain? Is there any other tips or advice you could give for a lot of us out here who are suffering?
Definitely. That's a good question. So it's all about keeping a healthy lifestyle, eating healthy, sleeping well, sleeping on a supported mattress, avoiding lifting heavy things, exercising, keeping hydrated. All of these are helpful strategies that will help you manage your pain.
Well, doctor, thank you so much. For viewers watching who are looking for more information, where can they go?
We strongly encourage people to have conversations with their healthcare providers about their back pain, about the different treatment options that are out there, like NSAIDs, that are accessible, they're non-interventional, they're non-surgical, and they're evidence-based, and they may be an option to help you relieve your acute low back pain and may help you get back to living your life.
Well, thank you so much for joining us this morning and sharing your insight with us.
Thank you.
We want to remind you that each person's case is unique, so we urge people to speak with their healthcare providers about proven options like NSAIDs for lower back pain. In the meantime, you can find more details on this medication at bayeraspirin.com.